The Prix Galien Pro Bono Humanum Award for individual service to improve the state of human health was renamed this year to Dr. P. Roy Vagelos Pro Bono Humanitarian Award. This award for global health equity is presented tonight in a ceremony recognizing outstanding achievement for Bill and Melinda Gates. But first, we'll have plenty of time to celebrate Bill and Melinda. First, I just want to recognize why it was so special and important to me and the jury to rename the award. Dr. Vagelos was the first recipient of the original Pro Bono Humanum Award, established in 2007 under the sponsorship of the late Foundation Honorary President and 1986 Nobel Peace Prize recipient, Dr. Elie Wiesel. That first award cited Dr. Vagelos for his unprecedented decision as CEO of a major pharmaceutical company to donate the drug Ntds to patients in 34 countries to treat and prevent river blindness, a parasitic disease that ranks as a leading cause of preventable blindness in developing countries for as much and as long as necessary. As a direct result of this historic act of moral leadership, more than 2 billion treatments for 250 million people in affected areas of the globe have been donated by Merck & Company over the past 30 years, resulting in the eradication of the parasite in numerous countries in Africa and Latin America. Simply amazing. So I think especially for all the young people beginning your careers who are here tonight, or no matter where you are in your career, I want you to know that the award committee's decision to rename this award in honor of Roy Vagelos highlights how one man can apply the tools of innovation to improve the human condition, and this donation helped so many millions. The decision also helped transform the mission of today's multinational healthcare enterprise to include this commitment to opportunity and equity for all. So I'm pretty excited to actually give this award to my bosses, although I didn't plan that, Bill and Melinda Gates. So I just want to read a little something to you about why we felt it was absolutely the right thing to do as the committee. As co-chairs of the Bill and Melinda Gates Foundation, they've catalyzed unprecedented progress in global health, poverty reduction, and public education in the United States. Their leadership has revolutionized the world's approach to international health and development, established new models for philanthropic investment and partnership, and really combined the public and private sectors to advance breakthrough solutions and address many of the world's most difficult challenges. The foundation was established in 2000, and Bill and Melinda have turned caring into action, yielding measurable results in polio and malaria elimination, reducing child mortality and neglected tropical diseases, and helping low-income farmers make more money and grow more food. The committee also recognized their role as early funders of Gavi, the Vaccine Alliance, a unique public-private partnership to increase immunization coverage to low-resource settings. Bill and Melinda are internationally recognized for their humanitarian efforts and their advocacy for gender equity. All of their work is grounded in one simple guiding principle: all lives have equal value. Well, I could tell you how special and meaningful this recognition is to Bill and Melinda, but I'd like you to hear it for yourself. Please watch the video.
Good evening, everyone. We wish we could be with you tonight. We're honored to receive the Roy Vagelos Pro Bono Humanum Award for Global Health Equity. Roy is a hero in the fight against global disease. He established a new business model for productive partnerships in global health, which helps make our work possible.
When Bill and I created our foundation nearly 20 years ago, our vision was simple: to give every person the opportunity to lead a healthy and productive life. That led us to the fight against infectious diseases like malaria, tuberculosis, and HIV, which affected hundreds of millions of people worldwide.
We quickly learned that for many of these diseases, there was a big gap between the available tools and what was needed to prevent and eliminate them. Innovation was key, and it still is. That's why we invest in the development of new and better diagnostics, drugs, and vaccines. And we do that by partnering with the private sector.
The Prix Galien Awards recognize the world's brightest minds and most innovative companies. They are a true celebration of the hard work required to produce life-changing interventions. Congratulations to all of you. There is still a lot of work to do to break the cycle of disease and poverty, but Bill and I firmly believe, and the evidence shows, that life is improving for more people more than ever before.
That is what makes us optimistic about the future, and grateful that all of you share our ambition. We're thankful for the recognition this evening and excited that Katie Owen can be there to celebrate with you in person and share more insights about our work. Thank you.
So I'm extremely happy that I get to invite my colleague, Katie Owen, from the Bill and Melinda Gates Foundation to accept the award on behalf of Bill and Melinda and make some remarks. And I'd also like to celebrate and welcome Dr. Roy Vagelos to give Katie the award together with me.
Thank you very much. As you heard, Bill and Melinda are very honored and humbled, thank you, to receive this award. And they both regret that they couldn't be here in person to accept it with all of you and to celebrate. I suspect that you also regret that I am not Bill or Melinda. Trust me, you are not alone. No, in truth, most days I wake up and I love my life. I had the, I don't know if you'd call it honor, had the experience a few weeks ago to understand a little bit of what it was like to walk in Melinda's shoes. I was walking out on the sidewalk in Seattle from my job as the head of neglected tropical diseases at the Bill and Melinda Gates Foundation, and I was sighted. I had someone, no kidding, I had someone snap these pictures of me. Surely they were going to be very disappointed when they got home and realized, no, they did not just get a picture, an exclusive photo of Melinda Gates. There are worse doppelgangers to be. Even though I can't offer you the direct comments of one of the most recognizable and impactful couples of all time, what I do hope to do over the next few minutes is to share some of their work and also to continue to honor Dr. Roy Vagelos, in whose name this award that I am receiving on their behalf was named. Tonight, we're here to honor visionaries, and there are few that have impacted global health more than Dr. Vagelos. We sometimes use the word living legend to describe TV personalities or superstars or even wealthy billionaires. But Roy really exceeds to that title. For those of you who may not know, Dr. Vagelos was the lead scientist at Merck with the statin drugs, lovastatin and Zocor, revolutionizing the treatment of heart disease. My guess is that many of you in this room probably are on some of the drugs, or at least the second generation of the drugs that Roy helped to develop. After many years as a researcher in the research laboratories, Dr. Vagelos ascended to the role of CEO at Merck. It was here that he was faced with a difficult decision. This drug that Sue talked about earlier, ivermectin, now the trade name Mectizan, came in front of his plate. It was a drug that had the potential to truly revolutionize treatment of parasitic diseases, and this disease, river blindness. It's a disease where the parasites crawl across the inside of the eye and die there, and they cause blindness. It affects hundreds of millions of people. They're people that probably most of you have never met because they live in areas of the world where there is essentially no market. Dr. Vagelos was faced with a difficult decision. Is this a medicine that is worthy of being developed? And is it worthy of being commercialized, even though there is no financial market? And what Roy chose to do was transformational. He chose to not only have the drug developed, but in fact also to donate the drug, as Sue said, as much as necessary, for as long as necessary, for all the people in the world that need it. It was an amazing commitment. It's an amazing commitment that was made many, many years ago, and still today, in 2018, is being carried out. On the backs of this pivotal commitment, in 2012, a group of pharmaceutical companies, the World Health Organization, public and private partners, Bill and Melinda, came together to sign the London Declaration on Ntds. The London Declaration on Ntds has subsequently become one of the biggest, most comprehensive global health initiatives in all of the world. Pharmaceutical partners of the London Declaration donate billions of drugs every year. Last year, the NTD community actually set a record in the Guinness Book of World Records for the number of doses delivered in 24 hours, donated and delivered. Any guesses? Numbers? 200 million doses donated and delivered in 24 hours. Since 2010, success has been so dramatic that today, more than 400 million people are no longer suffering from one of the NTDs. It's an amazing number. In addition, we're on target for eliminating trachoma as a public health problem in most countries. Guinea worm disease, which just a generation ago affected millions of people, last year there were 30 cases of guinea worm disease across the globe. Thanks in part to Dr. Vagelos' decision to donate ivermectin, river blindness has been eliminated in nearly all of the Americas. Investments in R&D have also given us better tools to prevent, to detect, and to treat NTDs. This includes improved drugs, diagnostics, and vaccines, mapping technologies. All are accelerating progress against these diseases. I wish I could tell you, based on all of these successes, that we're done, that the fight is over, that I'm personally out of a job, that with 2020 around the corner and this target of this London Declaration to eliminate these 10 diseases or control or eradicate by 2020, that the job is over. But it's just not true. Unfortunately, let's go back on that slide. Unfortunately, there's still work to be done. The good news is we are winning. The commitment from pharma, the commitment from endemic countries, and the commitment from donor governments are making a difference. But most of all, we're winning on the backs of a single decision made by a single man, and that man is Dr. Roy Vagelos. in 2010, I was lucky enough to sit in the audience of this room like many of you. It was a very exciting year. We were celebrating the Prix Galien, which was awarded that year to Rhodatech. I was a scientist at Merck at the time. I was the key formulator on the vaccine, and we were so excited to receive this award. That year, instead of Katie Owen from the Gates Foundation, we got to hear Bill Clinton and Ban Ki-moon give stirring remarks about the innovation and the value of the innovation and the impact that that innovation was going to have on the lives of many. We at Merck were very excited about the possibility and the impact of this vaccine. Rotavirus disease was a disease that was killing about 500,000 people a year at the time. We knew that this vaccine could make a difference. And in fact, the vaccine has been a massive success. It's been a massive commercial success for the company, and hospitalizations in the West have plummeted almost to zero. It was very exciting to be a part of the group that was being recognized for Rhodatech. Unfortunately, the story is not a complete story, because those hundreds of thousands of lives of people who were dying, these children under 5 that were dying of the disease, were dying in low-income countries, not in high-income countries, for the most part, not even in middle-income countries. And unfortunately, based on many decisions, Rhodatech as a vaccine has not made it to most of those geographies and most of those markets. The decisions that were made that resulted in that are numerous. Some of them were technical. Part of it was my own fault. Rhodatech was not formulated to withstand the temperatures of sub-Saharan Africa. Remember, I was one of the key formulators on that vaccine. Some of the decisions were business decisions, and I was at the company and I was a part of those decisions as well. They could have easily gone the other way, just like Roy Vagelos' decision did many years before, but they didn't. Luckily, GSK's Rotarix vaccine and Bharat Biotech and Serum Institute of India's vaccine have picked up the slack. So the story with rotavirus is actually impressive. Now you can put that slide up. The Institute for Health Metrics and Evaluation estimates that the number of deaths attributable to rotavirus disease has gone down to about half in just the past few years. You can keep it up. It's a nice slide, and it has beautiful maps. Part of the success behind the introduction of rotavirus vaccines in sub-Saharan Africa is Gavi. Sue told you a little bit about Gavi. Gavi is called the Vaccines Alliance. Gavi is a public-private global health alliance focused on creating equal access to new and underused vaccines for children in the poorest countries. The Gates Foundation was a founding partner of Gavi, and as Sue told you, it's one of the reasons why Bill and Melinda are being recognized tonight with this award for humanity. Bill is a big supporter of Gavi, not just a financial supporter. He recognizes that as a vision, bringing people together, bringing all of these organizations who are around the table, all working on the same goal, matters. That means endemic countries. That means the World Health Organization. It means UNICEF. It means all of you in this room, all of the pharmaceutical industry, without whose innovations none of this would be possible. Gavi actually created demand predictability. It created a market that largely didn't exist a decade ago, back when Rhodatech was in fact licensed. With funding support from Gavi, vaccine sales to low-income countries surged to $2 billion last year. These are low-income markets we're talking about, not the West. It's organizations like Gavi, it's alliances like Gavi that can create these solutions that are sustainable. But as with my other stories, success is not yet complete. Volume commitments to Gavi continue to be missed, with pharma pledging supply and sometimes simply based on the realities of manufacturing and the difficulties of manufacturing, not being able to meet those commitments. Even today, 12 years after the licensure of rotavirus vaccines, global coverage for rotavirus vaccine hovers around 30%. We have work to do. It is another fight, nonetheless, that we are winning. One of Bill's favorite statistics, one which underscores the progress that we're making, and one that he likes to quote a lot. In fact, I was just in a conference with him last week where what he said was he hoped that people got tired of hearing this statistics because he said it so many times. So if you remember no other numbers from this entire speech, please remember this set. Bill will be proud of me if you do that. In 1990, 11 million children under the age of 5 died around the globe. That's 11 million of children, our children's ages, our grandchildren's ages, our nieces and nephews, our grandnieces and nephews, 11 million under 5. Last year, that number was 5 million. It's impressive. It's a decrease of more than half in a single generation. That's even though the population has gone up by almost half. We have very good reason for optimism, just as Bill said in the video. Looking at the gains in child survival, progress has been much slower for infants, as well as for children in hard-to-reach communities. And we need to find better solutions for those 5 million that are still dying every year. One of the success stories for reaching hard-to-reach communities is the Mass Drug Administration program that's used to treat neglected tropical diseases, the same diseases I was talking about earlier with onchocerciasis. This is a platform that is used to deliver to over 1 billion people every year. The last story I'm going to tell you is about how we leverage that platform a little bit more broadly. Several years ago, a surprising observation was made on the backs of the trachoma program. So trachoma is another neglected tropical disease. It causes blindness. And there is a drug that's donated by Pfizer. It's called azithromycin that has really put this disease on the run. Trachoma as a public health problem is near elimination. What was noticed was that in those areas that had a trachoma program, it seemed like there were fewer kids dying as well. So there seemed to be a decrease in under 5 mortality. The Gates Foundation, along with many partners, academic and otherwise, including Pfizer, donating the medicine, decided to sponsor a large-scale clinical study. Ooh, I better talk fast, food is coming. This large-scale clinical study had 190,000 kids enrolled under the age of 5. It was in Malawi, Tanzania, and Niger. We wanted to test in a controlled way, were the results that were seen anecdotally actually real or not? Obviously, I wouldn't be telling you this story if they weren't. And in fact, what we see is a significant decrease in under 5 mortality based on this very simple intervention with a drug that's donated right now by Pfizer. The finding presents, and I should say as well, the interesting thing about this is that the most important effect and the highest impact of this drug was in the youngest kids and the kids in the highest mortality settings. So exactly that age group, those 5 million that are still dying. The finding presents an opportunity to improve survival where progress is hardest. Azithromycin has many of the qualities you would want in this context. It's safe, it's well tolerated by children, it's inexpensive, it's easily administered, a straightforward oral drug. It's highly stable, it's already widely used by trachoma programs, and in fact, to date, over 600 million doses of this drug have already been administered to eliminate trachoma. The fact that this drug actually works in terms of improving child health and decreasing child mortality is a pretty amazing event. It's innovation in action. We can actually teach this old drug new tricks. It's the kind of innovation that makes me proud to work at the Gates Foundation and proud to work with industry partners such as you. What has impressed me most during the 5 years that I have worked at the Bill and Melinda Gates Foundation has not been the Foundation's privileged access to vast resources. Many of you and your companies have access to similar levels of resources. Maybe not to donate every year, but still, It's a lot. We're a drop in the ocean, just a drop, compared to all of the resources when we look at everything combined. What has impressed me, rather, has been the commitment by two intelligent, ethical individuals to do what is right, to take the time to understand the complex issues, to not settle for the easy way out, instead to commit to doing what it takes to make the most positive difference possible, just because it's the right decision. I'd like to think that in that, we don't each need to give away billions of dollars every year to make a difference. All we need to do is make one right decision, just as Dr. Vagelos did. In closing, one of my nephews is a newly minted doctor. He represents the best and the brightest of the world's future, and it's not just because he's my nephew. He said to me recently, "Aunt Kate, I'm not like you. I don't want to change the world. I just want to deliver one more baby." And my thought at the time was, well, for that one baby and that one mom, you are changing the world. It was a good reminder to me that we all have our own contributions to make. In this room, we have some of the brightest, most successful people to ever contribute to the discovery and development of new interventions in health. Your efforts will indeed change the world, and they'll reach their maximal impact at maximal speed because of your hard work, your leadership, your dedication. On behalf of Bill and Melinda, I would like to acknowledge the accomplishments that have brought you here. You have been nominated for arguably the highest prize in health, the Nobel Prize of the pharmaceutical industry. Congratulations. Finally, I would like to thank the Prix Galien Committee for recognizing Bill and Melinda with the Roy Vagelos Pro Bono Humanum Award. They humbly accept the award, knowing that their ability to reach their maximum impact at maximum speed rests on the leadership, the dedication, and the decisions made by all of you. Thank you.